Swayam Prabha. Digital India. Educated India.
Hello dear students, I am Dr. Mona Semalti from HNB Garhwal University, Srinagar, Garhwal. I welcome you all in this module, and today, in continuation to our previous modules of skin related problems and their treatment, in this module we will discuss few more skin problems and their remedial part. So in this module we will discuss about prickly heat, wrinkle, acne and blemish. So all these four problems we are going to discuss what are the causes behind and what is the remedy for these skin problems. So this is going to be our learning outcome. So after going through from this module, you will be able to know yourself different causes and treatment of prickly heat, wrinkle, skin, acne and blemish. So this is going to be your lesson plan. First, we will discuss prickly heat and then wrinkle, acne and blemish. So we will start from the prickly heat. So it is a condition which arises when sweat ducts become clogged and the sweat cannot get the surface of the skin. Instead, it gets trapped beneath the skin surface, causing a mild inflammation or some sort of rashes. So what it is prickly heat? It is due to when your sweat ducts are clogged by some means. Okay, so it is the heat rash characterized by itchy red spots which develops on the chest and under the armpits and between the thighs. Okay, now common names are heat rashes. Okay, or malaria also we call them sometimes. Okay, so this is about prickly heat. Now heat rashes type. So what are the types of heat rashes? Clear heat rashes, this is also called malaria crystalline. Okay, red heat rashes, malaria rubra. So these are technical terms. You just remember clear heat rash and red heat rash. Okay, you can also remember their technical terms. Okay, so it is the clear heat rash. This is tiny blisters that looks like small bits of sweat which are seen if the sweat is blocked at the almost superficial layer of the skin where the sweat ducts open on the skin surface. Okay, red heat rash if the sweat causing inflammation in the deepest layer of your epidermis. Okay, so it is referred as malaria rubra. Next is white yellow heat rash. This is malaria pustulosa. When pustules, pustule is a kind of pimple which are like they have pus in them. So they develop lesions of malaria rubra in terms of malaria pustulosa. Deep heat rash, malaria profunda. Okay, less commonly, but after repetitive episodes of prickly heat, this condition is developed. So the heat rash may inflame the deeper layer of the skin called the dermis, when your dermis is going to affect. This is deep heat rash. The rashes are made up of more larger and the rashes is made more of larger and harder bump. Prickly heat causes. So moving to the causes of prickly heat. Creases in the skin like neck. Okay, some sort of little folding it is. Okay, neck, armpit, where your skin is in contact with the uh, adjacent skin, okay, which makes it difficult to air to circulate and preventing sweat evaporation. When this kind of problem is there, prickly heat arises. Okay, tight clothing can prevent the sweat evaporation. Okay, and thick cream, when you apply thick cream, lotion, that clog the sweat ducts. Okay, heat rash may occur as a side effect of medication also. So it depends. It depends on the condition and the type of heat rashes is observed in the patient. Okay. Now, what is the prevention? See, drink plenty of water. The very importantly, for all skin conditions. So, dear students, for all skin conditions, whatever it may be, we always the very first thing we say that drink plenty of water. So, because heat rashes remedy part we are discussing, so we suggest here that plenty of cool water and electrolyte replacement fluid, even if you are not thirsty. Okay, small cup every 15 to 20 minutes. So this is first thing. And uh, the patient should be able to recognize the early signs and symptoms of heat induced illness and take appropriate action accordingly. Spend a less time if it is possible in direct sunlight, so avoid direct sunlighting. Take frequent breaks in cool and shaded areas. Wear light cotton clothes, okay, and loose fitting clothes. Avoid caffeine, which makes your body to lose water. Okay, so these are some prevention. Moving to the wrinkles. See, the wrinkle are the fine lines and the creases that forms in your skin. Generally, we say the wrinkles are always with the patient, with the persons of elderly age group, but it is not like that. Some wrinkles can become deep crevices or furrows and may become especially noticeable around your eyes, mouth, and neck. So, wrinkle typically appears as a result of aging process, as I said, such as glycation and habitual sleeping position and loss of body mass, loss of excessive body mass. If when a person has suddenly lost a lot of weight, so the skin becomes very loose and it forms a wrinkle temporarily as a result of the and sometimes it is also as a result of prolonged immersion in water, but that is temporarily completely. Next is this we are discussing age. When you get older, your skin naturally becomes less elastic and more fragile. So decreased production of the natural oil dries up your skin and makes it appear more wrinkled. When fat in the deeper layer of your skin diminishes, this causes loose, saggy skin and more pronounced lines and the crevices are visible. Smoking can accelerate the normal aging process of your skin. It contributes to wrinkle. This may be due to the changes in the blood supply to your skin. Now, what are the causes of wrinkle? See, first is exposure to sunlight. Okay, ultraviolet light. Ultraviolet radiation, which speeds the natural aging process, is primarily cause the early wrinkling exposure to UV light, which breaks down your skin's connective tissues. Collagen, basically the connective tissues are collagen that we know. Okay, collagen and elastic fiber, which lies up deeper in the layer of skin, which lies in the dermis part of your skin. So without the supportive connective tissue, your skin becomes loose. Your skin become loose and it basically loses the strength and flexibility. So skin then begins to sag and the wrinkles become they become sometimes the wrinkles become they are more visible. Next is repeated facial expressions. So facial movements and expressions such as squinting, smiling, it leads to fine lines and wrinkles. Each time you use a facial muscle and groove forms beneath the surface of the skin. So, and the skin edges, it loses its flexibility and no longer able to spring back in the place. Okay. So, this is less contributing factor, I would say. And so, these types of grooves becomes permanent feature in your face. So, this is one cause. Next is treatment of wrinkle. See, treatment, topical retinoids, very commonly uh, prescribed for wrinkle treatment, derived from vitamin A retinoids such as tretinoin and terazotine, which is used on the skin, and they may reduce the fine lines and wrinkles. Okay, because retinoids can make your skin burn more easily. You will need to use a broad spectrum of sunscreen and wear protective clothing daily. So retinoid may cause redness, drying, itching, and burning and tingling sensation. Okay. So this is one treatment for wrinkles. Next is non-prescription wrinkle creams. See, wrinkle creams, basically this is not a, we don't consider it as a complete medical condition associated. Okay, so that's why some non-prescription wrinkle creams are there. So anti-wrinkle creams, any of the cream, a number of creams are available in the market depending in part of the active ingredients. See, retinol, antioxidant and some peptides may result in slight to modest improvement in the wrinkle. So, or we can also connect them to your anti-aging creams. Okay, they are also used for the same purpose. Fillers is a biological or syntactical mean to inject in hypoderm. These are some sort of injections which are injected in the hypoderm or in the derma tissue. So to implement or to enhance a limited area of the body. Fine. So the used substrates are bovine collagen, because at the elderly age, when we reach, our skin loses collagen, the connective tissues, as we discussed in the previous slides. Okay, and okay, fine. Peelings is a medical treatment it consists of basically a micro abrasion of epidermis or the superficial and medium derma by means of some chemical and physical agents. Okay, so peels used in these treatments are pyruvic acid, salicylic acid, retinoic acid, etc. in 10 to 20% of concentration, in 10 to 20%. Treatment of wrinkle, lasers are also cosmetic. Use of laser represents a valid non-invasive interventions for the skin age group. And botulinum toxins. See, botulinum toxin injection for the treatment of facial wrinkle is one of the most common entry procedures. So, dear students, you need not to go in much detail about this thing. Just mention the causes and you can superficially mention the points which are the measures which are taken to treat the wrinkle. So moving to the next skin problem is acne. Fine. Acne is also known as acne vulgaris. Is a long-term skin disease that is very common also, and that occurs when hair follicles are clogged with the dead skin cells and oil from the skin, dead skin cells, and it is merged in the skin itself. So it is characterized by blackheads or whiteheads, pimples, oily skin, and possible scarring. So these all conditions result from acne, and it primarily affects the area of the skin, which is a relatively high number of oil glands, including face, upper part, and chest and back. Causes of acne. Okay, hormonal changes which occur due to puberty, pregnancy, and before the menstrual period. This kind of skin problem, we note this kind of skin problem. Increased sebum production. Of course, sebum production is a natural oil produced by the body. When the sebum production is increased, it somewhere it leads into the formation of a pimple. Okay, and then when we come in contact with the dust and the other environmental factors, so the condition becomes exaggerated. So the changes in the hair follicle, when the hair growth cycle we studied, we have seen there are changes in the hair follicle sometimes and associated with the other environmental conditions. Bacterial infection, of course, this is one cause, and stress is also another cause of acne. Certain medications also leads to acne as their side effect, and certain cosmetics, certain medicines, and unhealthy food habits. Okay, so these are few causes of acne. Now, types of acne, we will see some different types of acne. Non-inflammatory acne, it includes blackheads and whiteheads. These normally don't cause swelling. They also respond relatively well to OTC treatment. Okay, they are easily treated by the OTC products which are available in the market. Blackheads are comedones. So blackheads are comedones. Comedones is the technical term which we use for blackheads, and these are open to the skin surface and they are filled with excess oil and dead skin cells. Comedones, they stay close to the surface of the skin called whiteheads. This happens when the oil and the skin cell prevent the clogging hair follicle from opening. So this is about non-inflammatory acne. So this is not a much serious problem associated. It is easily treatable by using the OTC product. Next is inflammatory acne. Inflammatory acne. Papules, normally we consider it skin lesions, or comedones that becomes inflamed, forming a small red or pink bumps on the skin. So this type of pimple may be sensitive to touch. So when you touch, the condition becomes worse. Okay, the large number of papules may indicate moderate to severe acne. In continuation to inflammatory acne, there is another kind of pustules we say. So this pimple, basically this contains pus. So pus formation is there, and they resemble a whitehead and with a red ring around the bump, and it is typically filled with the white or yellow color pus. So avoid pricking and squeezing pustules. Pricking can cause the scar, and it can also develop the dark spots on the skin. Nodules. See, nodules are large inflamed bumps that feel firm in touch, and sometimes they are also painful. They develop deep within the skin and are painful. Nodules should be treated by a dermatologist. So it is a little severe condition. So over-the-counter treatment may not be much powerful enough to clear them up, but prescription drugs are effective in the treatment of nodules. Cysts are large pus-filled lesions that look similar to boils. Okay, like nodules, cysts can be painful and should be treated by dermatologists, and people with who develop this nodules and cysts are usually considered to have more severe form of acne. Treatment of acne, topical retinoids. Now we are discussing the treatment of acne. Topical retinoids are mainly used in the patients with non-inflammatory comedones in combination with the other topical and systematic drug in mild, moderate and severe inflammatory acne and also as a maintenance treatment when oral treatment is stopped. The retinoid which are used are tretinoins, isotretinoins, adapalene. Okay, so these are few names. Antibiotics. Okay, topical antibiotics. These are generally used for mild to moderate inflammatory acne. They are active against Propionibacterium acne, P. acne it is called, and therefore act on the surface of the skin to reduce the stimulus for inflammation of the lesions. Okay, the most popular topical antibiotic is erythromycin and clindamycin. So you might have seen that erythromycin cream for the treatment of pimple. Basically, sometimes it is prescribed by the skin experts. Okay, benzoyl peroxide. It is a topical disinfectant. So originally employed as a peeling agent for treating acne, and benzoyl peroxide has proven antibacterial activity against P. acne by releasing free radical oxygen. So they release the free radical oxygen which degrades the bacterial protein. So this way this treatment is given. Okay. Next is azelaic acid. Azelaic acid is a natural dicarboxylic acid that inhibits the protein synthesis of P. acne species. Okay, so it is an effective agent because it has bacteriostatic, anti-inflammatory and antioxidant property. So this benzoyl peroxidase and azelaic acid is the part of treatment of acne. Okay, so moving to the next skin problem, that is blemish. It's any kind of mark or spot, decoloration or flaws that appears on the skin. So the excessive sun exposure, hormonal changes, certain infections and stress are some primarily contributing factors in the development of blemishes. So depending on the condition causing them, some blemishes fade by their own while others need some medical treatments. Even though most of the blemishes are largely harmless, they can be particularly distressing if they develop on your face. Common causes of blemishes, sun exposure is very common cause. Prolonged long-term frequent exposure of the direct sunlight can cause considerable skin damage. Okay, and when the ultraviolet rays of the sun fall on your skin, that trigger the melanin producing cell, that is melanocytes, into the overreactivity. So this increase in melanin in the epidermal layer absorbs the UV rays and prevent them from reaching to the healthy skin cells. So this is one cause of blemish. Another is hormonal changes. Androgens or male sex hormones are found in both the genders. When these hormones are produced in excessive amount, the more frequent and potentially severe acne results. So this is one cause. Another is the viral and bacterial infection. Certain viral infections such as cold sores and chickenpox can lead to the development of the skin blisters on the skin, which often leaves behind blemishes. Bacterial infections also results in blemishes, and another cause is the genetics. Some people scars more easily than the other due to their inherited tendency. So these are the causes of blemish. And improper diet and the stress is another condition and another cause which results in blemishes. Excessive consumption of oily and dairy product is commonly suspected to trigger or worsen the acne. Stress, the people who lead stressful life are generally in the habit of taking too much of stress are more susceptible towards these blemishes or acne. The types of blemishes, blackheads, papules, nodules, acne, cyst, and cold sores. These are whiteheads. So these all comes under the facial blemish. Treatment of blemish. Okay. OTC medicine, prescribed topical creams. This is one treatment. Retinol, benzyl peroxide, salicylic acid creams, and prescription medicines. Stronger medicines such as isotretinoin may be needed uh, for the treatment of blemish. Vitamin C topical cream. So this is very commonly prescribed by the skin experts. Vitamin C is a potent antioxidant and it offers a variety of skin benefits. Okay, so which explain why it is a common ingredient, a wide range of skin product, because vitamin C is a antioxidant. Okay. So even natural vitamin C also helps in the treatment of blemish. Vitamin C based creams, ointments are used to treat even to treat the hyperpigmentation, premature skin aging, and other type of blemishes. Um, Body odor, certain food like it is perceived that unpleasant smell that body can give when bacteria present on the skin break down to the sweat into the acid. So controlling the body odor, we uh, wear the loose cotton clothes. So this way we can it is treated. Dark clothes tends to absorb more of the heat, so avoid the dark clothes. Use less synthetic clothing and deodorant and antiperspirants. So this is also part of treatment of the blemish. So these are few references. So let me summarize what all we studied in this module. So this module is in continuation to our previous module. There also we discussed about skin problems and their remedy. So in the previous module we discussed about dry skin, oily skin, and dermatitis. Okay. So we discussed different causes of dry skin and their treatment part. Oily skin, different causes of oily skin, and dermatitis, different types of dermatitis, and what are the reasons behind dermatitis and its remedial part. And in this module we discussed about other skin problems like acne, blemish, wrinkle, and prickly head. So all these problems we discussed in detail, their causes, their remedial part, and their prevention, and how they are treated overall. So dear students, in these two modules we discussed about the skin problems. Okay, different skin problems. So the now with reference to your exam point of view, see this I also mentioned in your previous module that the question it will come like describe different skin problem and their solution. Okay, so then you can draw a tabular form. You can draw it. You can summarize these two modules in one table form. How you will do that? Mention the skin problem, the different causes, and their remedial part, and if there is any specific thing or remark to mention. So dear students, this is your homework. Just now sit at home and compile these two modules in one table form so that it will be very easy for you to write it in the examination. So dear students, that's all for today, and stay tuned for more videos on cosmetics and cosmeceuticals, and thank you so much for watching this video.